Hey everyone, this is Dr. Boucher here, and today's video we're going to be presenting a patient again and showing the results. Today we're going to particularly be focusing on temple points. Temple points is something that patients often commonly ask. To someone who might not know what temple points are, they are these triangular areas right here on the sides of our scalp that narrow the forehead and frame the face along with the hairline. So patients often ask if they can have some temple points work done along with their hairline in order to narrow their forehead. And now typically when it comes to temple work, it's a very heated topic online, but in general, I would say you have to be a right candidate for it. I'd say even if you are a candidate for hair transplants to work on the hairline, on the crown, you might not be a candidate for temple work. Temple work is something that I think takes a lot of skill. If you're gonna get temple work done, you really need to go to a clinic that is very comfortable doing them. They have very specific angles that you need to put them in order for them to look natural and blend seamlessly. And you have to be really cautious about the patient's hair characteristic. The patient that I'm going to be presenting actually has a lot of unfavorable characteristics when it comes to doing temples, but we went ahead and did the procedure on him anyway, and I'll go ahead and discuss some caveats to his case, things that we did to make sure that those unfavorable characteristics of his hair type, what we did in order to overcome those issues. Okay, so here I'm presenting just how the patient walked in that day. This patient actually had a previous transplant with us several years ago. He initially just came in, just did a little bit of hairline tweaking. This is actually very common when patients come in. They just want to test the waters a little bit, just do a little, see if it works. And then after it grows in beautifully, sometimes patients come back and they want to be a little bit more aggressive, which is, exactly what happened with this patient. So here you see these photos, this is where the purple lines are drawn. This is the area that we're gonna work in that day. And as you can see here, we're doing some pretty significant temple work here. His temples have just naturally receded quite a bit. They're going towards more his ears. And so by working in these temples here, you can see how much of a difference it makes on his forehead shape and how much it narrows the size of his forehead. But yeah, these are just some different views showing the areas that we're going to work in. As you can see here in these photos, we actually blunted the temples quite a bit. And this is actually, as I mentioned before, in order to overcome the obstacle of his hair characteristic. He has very dark, bushy hair, very coarse hair, and often this can be very tricky to work with, especially when you're working in the temples. This is because the temples, if you look at someone who's never lost any hair in their life, the temples have the finest, softest hairs along with the nape of the neck. And so in this patient's case, instead of giving him more of a triangular, sharp temple point, we blunted a little bit. And this was to give it a little more of a softer appearance. When patients have thicker hair types, you really don't want to give these sharp angles, irregularities on the hairline or in the temples, just because it's going to stand out more. If you have fine blonde hair, for example, you can give those temples a little bit of a sharper look. But in this patient's case, in order to kind of give him the most realistic and most natural looking appearance, we kind of blunted the temples. In these next couple photos here is how the patient looked right before leaving our office. This is post-operatively. We did 1,800 grafts on him. Beautiful case, and as you can see, very densely packed to match his surrounding hairs. Okay. And so, yeah, temple work is very tricky, especially in this patient. I would say in most clinics, if he had walked in and asked to do some temple work, not to toot our own horn, but I'm not sure if they would have been able to give him the look that he's looking for, or at least a natural look. This is because in order to do these type of temple work, you really need to have technicians that can cut grafts very finely, and also you need to go to a doctor that can make slits very tightly packed in an angle to where it naturally blends with the rest of the native hair. But now I'm about to present to you just how the patient looked. The patient came back to our office 2.5 years later, so here are some photos of how he looked then. So as you can see here, focusing on the temples, just looks beautiful, matches the density of the sides of his head. And as you can see, it's a little bit more blunted. It's not as sharp, but that's what gives it that natural look. And then you can see that in these different photos here. It just blends seamlessly, and this patient has his hair very short too, which can make it a little bit more difficult to blend naturally, because you really need to dense pack it in order to match the sides. But beautiful case here. If you looked at him on the side of the street, there's no way you would tell that he had any sort of hair transplant or temple work done at all. And then here are some comparison photos. As you can see, he really narrowed his forehead quite a bit by adding these temples, and really frames his face a lot more. Temples are, I think, often needed in a lot of patients. This patient could have argued either way of whether or not to work on temples, but I'm glad that we did. In certain other patients, though, I would say, especially when they have a lot of recession, retrograde recession, where the temple points are creeping back all the way towards the ear. You really want to rebuild them, because otherwise, if you just do the hairline and you don't rebuild the temple works, it kind of looks like the patient has a wig on. But anywho, going back to this patient's case, it looks great. I think we achieved what the patient was looking for, and he was very pleased with the result. And yeah. And lastly, before I end today's video, because we not only did do some temple work, we also beefed up his hairline. So I'm gonna go ahead and show just a video of us combing through his hairline. And so yeah. So as you can see here, sprinkling some water in the patient's hairline, and having actually difficulty combing through his thick, natural, bushy hair. But as you can see, he has very dark hair and fair complexion. So you really need to densely pack it in order to make sure it doesn't look see-through. But I think we accomplished that. This patient hairline looks natural, it looks dense, and it frames his face, and I think it looks amazing. All right. So if you guys are interested in getting some temple work done, we do it very commonly here in our clinic. And so if you want this for yourself, I'll leave information to our clinic and the phone number for a consultation down in the description. All right, guys, you have a good one.